terms of, you know, how I think COVID has changed the way we practice MS and kind of looking ahead to the months ahead. It's interesting because, again, we're entering into the third month of this pandemic. And I think, much like, you know, regardless of whether you're a physician or not, the general public, I think initially your first reaction is always kind of sheer panic and fear. And I think in those early days, many MS specialists were really reluctant to, start disease modifying treatments in patients and even redose patients who are on some of these lymphocyte depleting agents. And we were very reluctant to bring any patients into the hospital. We canceled all the MRIs that our patients were scheduled for. But I think now that we're, learning a little more and understanding more about COVID in general, as well as what COVID means for our MS patients, it seems like we're becoming more comfortable with managing immunomodulatory and immunosuppressant medications in light of this pandemic. And I think we're finding a better way to move forward with MS care because there are all these unknowns related to COVID, but there is a really known and clear risk of neurological disability progressing when patients remain untreated or suboptimally treated with MS. Another thing that's been interesting is that many of our neurology visits have been converted to virtual visits. And this is something that in the neurology world, it's actually very difficult to do because you can't really, examine patients accurately. But I think we've started to become much more comfortable with this and creative with how we, assess neurological disability in our patients, using technologies like video conferencing and other tools where we can at least partially do a neurological exam. So overall, as the world slowly emerges from this pandemic, first of all, I think we're going to develop more rational ways to manage patients who are on immunomodulatory treatments. And I do think this kind of forced virtual care aspect will actually change how we approach clinical visits, even when we've emerged from the pandemic.